Hello, my dear curious and studious students of surgery. Myself, Dr. Mahesh Chaudhary. I am warm welcoming you in my surgery lecture series. This surgery lecture series contains entire surgery with anesthesia, with radiology, with orthopedic. So stay tuned with us. Let's start our surgery lecture series. Welcome again, my dear students, in my surgery lecture number 45, that is the umbilical and epigastric hernia. In this lecture, we will learn the exomphalos, major and minor, umbilical hernia in infants and children, paraumbilical hernia of the adult, and Mayo's operation in the incisional hernia, and epigastric hernia. All points will cover in this lecture. Let's start with me. First, the umbilical hernia. Three types of the umbilical hernia are seen in surgical practice. Exomphalos, umbilical hernia in infants and children, paraumbilical hernia of adults. First is the exomphalos, is developmental anomaly due to the failure of whole or part of the midgut to return to the abdominal cavity during early fetal life. So, the abdomen organs remains protruded, being covered by a membrane, which consists of an outer layer of the amniotic membrane, a middle layer of Wharton's jelly, and an inner layer of the peritoneum. Two layers of the exomphalos can be seen. Dear students, here is a picture of the neonate showing the exomphalos. The cavity or the organs remains protruded, being covered by a membrane which consists of an outer layer of the amniotic membrane, a middle layer of the Wharton's jelly, and inner layer of the peritoneum. This is the clear picture of the exomphalos. This is the second picture, what the sac is contained, the umbilical cord, their intestine, liver, and other organs are also contained in the exomphalos sac. The exomphalos minor, where the sac is relatively small and to its summit is attached the umbilical cord. Treatment: sometimes just a twist to the cord may reduce the content to the sac into the peritoneal cavity, and this is retained by the strapping applied firmly. Under no circumstances must this strapping be removed within fortnight. Then next point is the exomphalos major, in which the umbilical cord is attached to the inferior aspect of the large swelling containing small and large intestine and portion of the liver. Treatment: operation should be contemplated as an emergency, otherwise the sac may burst. Flap of the skin are created on both sides of the swelling by undermining the subcutaneous tissues. The flaps are attempted to bring over the sac of the swelling. A second operation may be acquired to bring the muscles over the peritoneal sac for closure in layers. Now the second point of this lecture is the umbilical hernia in infants and the children. This is a hernia through a weak umbilical scar, may be following neonatal sepsis. The treatment, as 90% of the cases are spontaneously cured within 12 to 18 months, reassurance to the parents is all that is required. The protrusion is kept reduced continuously by a pad or a big coin or a round piece of metal on the umbilicus, and this is kept in position by a pad of adhesive plaster which is applied by pulling the skin and abdominal musculature together. This prevents the hernia to come out and will obliterate the sac by adhesions. The operation is only justified when the hernia fails to disappear after 18 months or so. Now the operation, it is desirable that the umbilicus should be preserved so that the child may not be psychologically handicapped. Here is a good picture of the umbilical hernia, you can see on your screen. This is the paraumbilical hernia, image of the paraumbilical hernia in the adults. Now the paraumbilical hernia of the adult. In adults, the hernia does not protrude through the umbilical cicatrice. It is protrusion through the linea alba just above the umbilicus, that is the supraumbilical, and occasionally below the umbilicus, that is the infraumbilical. Symptoms: pain and swelling is there. Treatment: operation is the treatment of choice. Gradually, as time goes on, the hernia becomes irreducible and eventually strangulation may occur. Mayo's operation is usually practiced. The neck of the sac remains free from the adhesions. This makes the principle of the operation that the hernia sac is reached at the neck first. This is the typical picture of the umbilical hernia, which is reduced by the fingers on lying down position. This is in the erect position. The hernia is come out through the abdominal wall through the umbilicus. Now the Mayo's operation. A transverse elliptical incision is made around the umbilicus, the rectus sheath, to expose the neck of the sac. The content are freed from the adhesions. The peritoneum of the neck of the sac is closed with catgut stitches. The gap in the linea alba is extended laterally for 1 inch or more for sufficient overlapping. Now a row of the mattress stitches are tied so that the lower margins is lifted up and dipped to the upper margin for about 2 inches. In fatty patients who ooze blood and liquid fats, a drain may be provided with at the end of the wound. Otherwise, there is a high chances of the infection of the wound because there is a oozing and the liquefaction of the fat. Here is a good picture showing the Mayer's operation. First step, the sac is open and layer by layer suturing is there. This is the another image after the suturing. Now the mesh is implanted. Now the structure's name: femoral hernia orifice, carpa fascia, Hayes ligament, pubic tubercle, Glimberan ligament, fascia of pectineus, cribriform fascia, fossa ovalis, scarpa fascia and the fascia lata. Now the next point of this lecture is the epigastric hernia, that is the fatty hernia of the linea alba. When a hernia protrudes in the midline through the interlacing fibers of the linea alba anywhere between the umbilicus or at the xiphoesternum, it is called an epigastric hernia. Hernia begins at the protrusion and of extraperitoneal fat, and that is why it is called as the fatty hernia of the linea alba. Now the etiology: it seems that the sudden strain helps to bring out such hernia. Such strain will lead to tearing of the interlacing fibers of the linea alba. Clinical features of the epigastric hernia are three clinical types are there: symptomless, painful swelling and referred dyspepsia. Such dyspepsia may also be due to the epigastric hernia. Treatment: operation is only justified if the hernia is giving rise to the symptoms. This is the typical image of the epigastric hernia you can watch on your screen. This is the animated picture of the epigastric hernia. The site of the epigastric hernia is clearly seen between the xiphoesternum and the umbilicus. The rectal abdomen muscle is seen. Dear students, you can watch the operations of the umbilical hernia and the Mayo's operation in the incisional hernia and epigastric hernia on the YouTube to clear the concept regarding this. Here is the end of our surgery lecture number 45, that is the umbilical and the epigastric hernia. Thank you.